Jonathan is on today. I go back to my class reunion, when they have them every 5 years, I've been going back. And over the last 5 or 10 years, we have lost.
I tell people, you're gonna have replaced before.
We have lost over 100 people.
Hi, welcome for coming today. My name's Sherry. I'm the one that's been talking to you and texting you back and forth on the phone. We're gonna go ahead and get started. I think we've got some latecomers that'll be strolling in. And so what we're gonna do is we're gonna start out with a couple of videos. If you haven't placed your order already, go ahead and circle your order on the menu and the waitress will come by and pick it up. And then throughout the seminar, she'll come in and bring your lunch to you. And then Dr. Jen will be in just a few minutes to take over. Thanks for coming.
I've heard this bill sale thing is good.
You hear that?
My biggest struggle was movement without pain,
Okay,
because it was a constant pain.
yeah.
And like I said, your definition of your feeling normal changes when it's a constant pain. You make adjustments, and that does become your new normal.
It's terrible.
It is. You can't move as freely, and you make adjustments to deal with it.
How did you cheat? What kind of adjustments did you?
It's like not being able to bend down on my knees for 20 years. I mean, that in itself was a big one.
Yeah.
And I think day 2 after the stem cell therapy, no pain.
That was
And I
awesome.
could literally crawl on my hands and knees.
I was gonna
Like,
kill
yay.
you for crawling on your knees.
Like I can do it. I can drop something and one of the co-workers will go pick it up. Leave it, I'll get it. I can bend over now and not get stuck.
So, are you happy with your stem cell results?
Yes, wish I would have done it 20 years ago.
You did great. You did great.
I mean, it was like a day and you could tell a difference.
That's awesome.
I can sit with my legs tucked up underneath me and hop up.
Wow.
I don't gimp. I would literally get up at the same time my mom would, and I walked as gimped as she did. I moved as stiffly as she did, and she's 20 years older than I am.
Well, we don't get old around here.
No,
do we?
and everybody, doctor-wise, everybody always said that with the type of injuries I had, arthritis. So you do think it's because I'm aging.
Mhm.
It's just progressively going to get worse.
That's terrible.
Because there's nothing that they offer for it.
Yeah.
Nothing.
Yeah. No, absolutely. So if you could tell anybody that has anxiety, depression, or pain, or suffering from whatever, if you could tell them one thing, what would it be?
Don't wait. And don't fear.
Mm.
The injections, I think, give a lot of people a little bit of a fear.
Mm-hmm.
Not many of us like needles. But it didn't hurt. I only felt one shot. And she did both knees and the hip.
Mm-hmm. I think the biggest, specifically with stem cells, since you had such great results in your knees from your stem cells, it's, the needle,
Mm-hmm.
is it gonna work? And then, do I trust enough to spend this much money, right? Kind of.
Money-wise, we are our biggest investment.
Yeah.
If you can't enjoy your life, then what are you living for? If you can't live it without some sort of pain throughout the course of your day.
Yep.
So on the money end, it was a no-brainer for me. I would do it again.
We got new knees.
Mm-hmm. 2 new knees and a hip. A new hip. Because I don't wake up anymore with the hip.
With the hip, yeah.
Mhm.
So what was like life before stem cells? What was a day like before stem cells?
I had constant pain in the knee, the hip, and a catch in my neck. The neck was fixed with the adjustments through your chiropractor, but the hip and the knee was more of a scarring tissue issue. There was just so much scarring tissue there. And that's why the doctors kept saying arthritis will set on as you age. And as I age, it progressively got worse. Like I said, I couldn't get on my knee. I haven't been on my knees in 25 years. No pressure on that knee. It was excruciating. The hip, in my sleep, if I rolled on it right, it would wake me up out of a dead sleep. And like I said, with the stem cell therapy, when she did that, it was almost immediate relief on mine.
Yeah. That's awesome.
Mm-hmm.
We're so proud of you.
And I would so do it again. Like I said, the biggest thing with me that I would do different is I would not have waited 25 years to do it.
That red dot.
My name is Rachel Moore, and I have been taking advantage of chiropractic since I was, since 2012. And I've had good chiropractors and bad chiropractors and okay chiropractors. And now I have an awesome chiropractor. And she is helping me with all kinds of different things. The reason that I came here was I twisted my knee and was afraid that I would end up having to have surgery, so I was going to try any kind of alternative to that was possible. So the first place I went was to an acupuncturist, and he did try his very best, and he did give me some relief, but it was not enough. In the interim time, I had several people tell me about Dr. Jen and how awesome she was and all of the wonderful things that she had done for her patients. So I kept getting the message, you need to go see Dr. Jen, you need to go see Dr. Jen. So finally, I got smart and came over and saw Dr. Jen. And she did a full assessment of me. And not only did she work on my knee, but she is also working on my overall body straightness. I do, just like I guess anyone at my age, I have a lot of crookedness in my body from things that have happened over time. So I've made tremendous progress in that. And I've been coming here since last September. And that part of my program is just about complete. She worked on my knee and she gave me relief, but it really wasn't as much as what I really needed to go back to having a regular life, being able to walk around and, okay, maybe dance a little bit. So she suggested stem cells. And we talked about that, and she told me her story about her rotator cuff and her knees, where she had had such success and so quickly with the stem cells. And so I went in for a consultation, and she and Jenny and I talked about it, and they gave me the rundown on what to do, what I would need to do ahead of time, what I would need to do for the first 3 weeks afterwards, what the treatment itself would be like. And so I said, you know, I just don't want somebody to cut into my knee and I don't want the long recovery time that it takes from surgery, because I got a lot of things to do and I'm on the move all the time, and that just didn't fit in with my lifestyle. So I got everything all signed up, went in, had my treatment, and I will tell you that I did not experience any pain from the treatment itself. And yes, she did put a needle all the way into my knee joint. There was some discomfort, but there was no pain at all through the treatment. And afterwards, Dr. Jen talked to me and she said, now your knee may swell up because we've put a lot of fluid into your knee. But I didn't even really experience any swelling. As a matter of fact, 1 week after my treatment, my knee, which was about half again the size of the other one, was already had already shrunk down to the size of my knee that was okay. And it's been 5 weeks now, and it just continues to get better. They tell me now that all of the cells have decided where they need to go and what they need to be, and they're in there making new stuff for me inside my knee. And things are just getting better and better. I can walk better. I don't have any discomfort. I haven't had any discomfort. Maybe the first week, maybe just a little bit when I would lie down to go to sleep, but it was just twinges. So the process for me has been basically like nothing happened, and it just healing like crazy. So I'm very excited about that, and I encourage people to check it out, because think about it. I mean, you're months having to hobble around and hop around and go to the doctor and all of that when you have surgery, and this was just like 1 day in and then it was done. So if your knees bother you, or if your rotator cuff bothers you or anything like that, you should definitely talk to Dr. Jen about stem cells, because to me it is just a miracle.
Good morning. Oh, we are going to have fun today, guys. So, good morning. Okay. I'm a little spicy, is that okay? I'm a little spicy. 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 I don't even know a better word for it. So welcome to Heller Healthcare. Today we're going to do a presentation on regenerative medicine. So I'm going to go through a lot of terms today that you may not be familiar with, and I will explain all of them, what they mean. And so think of today as a new way of healthcare, a new healthcare system. Maybe. Very good. So hi, I'm Dr. Jennifer Heller. I am a chiropractor. I also have a background in physical therapy. I did that for 8 years before going back to school for alternative medicine for chiropractic. I have a bachelor's in human biology, physical therapy, and then my DC. In my office, we do what's called integrative medicine. I'm from St. Louis, and in St. Louis, I was used to a very specific type of healthcare system where chiropractic can talk with orthopedic medicine, orthopedic can talk with neurology, I can talk with neurology, I can talk with oncology, to be able to better help my patients, and we all work together for the same goal, for one patient. And so moving here 4 years ago, I started to reach out and to connect with our current healthcare system, and I struggled a little bit to be able to communicate to have the same goals for our patients. So what we are building and what we have built in my office is called integrative medicine. We have multiple departments all integrated together.
part of our medical team. This is Jenny Sharp, Captain Jenny Sharp. She's a captain in the Air Force. She is our nurse practitioner. We have a PA and a nurse practitioner in-house all the time. They help provide our medical services, our natural, holistic-minded, but traditional medicine services within our office. Jenny is one of the practitioners that would be doing stem cell therapy, and that's one of the therapies we're going to talk about today. So the future of medicine is really what's going on in our body. You know, you can take a pill for many things to help chemically change how our body functions. However, if you can change the healing from within to help prevent having to take extra chemistry within your body, you're going to be doing pretty good for yourself. The problem Time Magazine found and labeled correctly back in 2004 is the secret killer of the human body really is degeneration. As we age, we degenerate, and degeneration comes from the death of stem cells. And so the answer to degeneration causing inflammation is regeneration. So lots of terms. But if we can regenerate our own tissue, if we can heal our body from within, if we can heal the inflammation that is caused from poor wear and tear, from chronic repetitive motions, from postural issues, then we can help heal from within and then maintain what we have. So part of the talk that I give with my patients that go through different programs in our office is how to maintain a positive outlook. Because if you become a patient and we start a process of correcting curvatures or healing tendons or whatever we need to do, the power that you give yourself and the power that you put into that thought process matters. And so what I like to tell our patients is when they come in, you're going to get the mom finger. You're going to get this from me, and you're going to get this face, because we don't just provide a one-and-done injection or a one-and-done adjustment. You get us, and it's about that putting that power into healing. And so, you know, I'm not afraid to pull out my mom finger and say, are you doing your homework? So be prepared. All right, so this is one of Jenny, our nurse practitioner. This is one of her favorite spots that she likes to do the talk with. And she does apologize for not being here. She's treating our patients right now. So I'm going to have you guys answer this. Does a painkiller fix your joint, your arthritis?
No.
Oh, you're spicy. I like it.
Same time,
No, it does not. No, it does not. So there are two types of painkillers. So there are painkillers that help with inflammation. Ibuprofen would be a good example of that, okay? And then there are painkillers that work to help kind of dull the sensation that your brain feels. Does it fix the actual joint? Yeah, no. Nope. Does cortisone, who knows what cortisone is?
It's a high pain.
Yes, it's an anti-inflammatory injection. Does cortisone fix your joints? No. Yes, ma'am, it can. So cortisone is an anti-inflammatory steroid that typically gets injected into a joint to help calm down inflammation. So remember, inflammation has a lot of chemistry within it that causes pain. So the whole point of cortisone is to lower the inflammation, lower that pain threshold, and then hopefully the body can kind of recover and get up and over that hump. But you're right, it does degenerate tendons, ligaments, and cartilage, which is why you can only have 3 per year. So is it a great idea to fix a joint? No. So I come from the medical background. I worked in a hospital for a handful of years and then in rehab units for the rest of my physical therapy career. And I am definitely well aware of the medical system, the traditional medical system. So we're going to review this. And I like the medical system. I do. You know, the one struggle that I had with it is that there are very specific protocols that they have to abide by. most of them because of insurance and the way that insurance works, abiding by those protocols. So by no means do I fault the medical system, do I fault our healthcare system here in Brunswick at all. They do a lot of great things, and I love my MDs that I work with. However, is there a better system that we can do? So typically, we have our injury. So I see one of our friends here has a boot on. So let's call it ankle injury. So we have our ankle injury, and that causes inflammation. So we have swelling, redness, pain. Well, then it's probably difficult to walk. So we go to our doctor and they say, let's try physical therapy. Let's strengthen it and stabilize it. You know, great. All right, let's strengthen and stabilize it. However, my pain is just so high, I can't participate very well. All right, well, let's start with some tramadol and 800 milligrams of ibuprofen. Let's get that down so that you can do strengthening and stabilization for physical therapy. Well, we can't get over that hump, so let's try something a little bit stronger, more medications. Well, that didn't quite do it, so physical therapy, they graduated me, they can't help me anymore, so let's try cortisone. We'll do one little injection because this is our protocol. Do a little bit more invasive, okay, makes sense. So we do a cortisone injection. Well, that didn't really take care of it. So you go back to your doctor and he says, well, you know what, we tried conservative care. It's time to go in and clean up that tendon just a little bit. Not gonna be a bad surgery, but let's just go clean it up. So we get it cleaned up, we get more meds for the post-surgical. We go back to physical therapy because now we need to strengthen and stabilize again with your newer ankle. And you get more meds because you can't quite do it. It's not strong enough. Inflammation is not down enough. So we go back in, all right, so I'm so sorry, hasn't quite worked yet. Let's do a little bit more invasive surgery. Let's put a pin in there. Let's put a pin, let's stabilize it, so now you're not gonna have a problem afterwards. And we still have our injury because after surgery comes scar tissue. And scar tissue just in itself can bind down nerves, ligaments, muscle tendons, and damage all of that, so we don't have good blood flow. So this is our traditional merry-go-round of medicine. And you can't blame them. I mean, this makes sense. Conservative, a little bit more invasive, a little bit more invasive, and these are the therapies that are available currently with traditional medicine. So what happens if we don't do traditional medicine? What happens if we do alternative medicine, functional medicine, or regenerative medicine? And that is what we do in my office. So this is a video with Mel Gibson talking about stem cell therapy.
Movie star Mel Gibson is a regular visitor to the Stem Cell Institute. He has treatments for a shoulder injury, and he's become an advocate of stem cell therapy. Mel's father, Huck Gibson, had his life transformed by going to Panama. His treatment pulled him back from the edge of death, aged 92. 7 years later, he's thriving.
Well, he was pretty old. He was 92, and he wasn't doing too well, and I took him to the Mayo Clinic in Arizona, and they said, you better leave him here, he's going to be dead. And I'm like, nah, really? So they kept him there 10 days, stabilized him, identified a number of problems. Just wearing out, the kidneys, he had some congestive heart stuff and lung stuff, and various other things. His hip was, hurting. He was not ambulatory, and he was in a lot of pain and pretty listless and sick. Night, what do they call it? Night terrors, or where he wasn't quite lucid. But all this stuff was draining his energy and affecting his mind, and it was the full kind of old indignity, the 92 years of age. So I figured, if he could just get his hip under him and get and they said, well, you shouldn't really, he's pretty old to be doing an operation like that, you know, the recovery probably, it'll take so much for him to recover, he'll probably, that might take him out. And I'm like, well, we can't do that. And then my brother said, look, why don't you try, I got this website, this like adult stem cell thing. I'm like, adult stem cells, yeah. So I asked a doctor friend of mine, you know, what he thought about that. He says, stay away from those guys. It's unproven. He's like, it's, you know, down in Panama, it's lepers and banana boats and three-legged dogs. And I'm like, well, you know, you're exaggerating. And it turns out he was. But I said, look, can we talk to these guys? I'll talk to them. So I got this friend of mine, Brad, who was the doctor at Mayo. And we spoke to them for an hour. And it was interesting because he asked them questions I never would have thought of. I mean, what is a mesenchymal cytokine? You know, I mean, you know, out of sight, out of kind. I don't know from nothing. So he's talking, and then I asked him to translate all this, and he translates it in a pretty good way. He puts it into the sort of vernacular for me, and we're talking about it back and forth. He says, let's call him again. And we talked to him for another hour. And we talked to Neil Reardon and Jorge. And they both talked to us on the phone, and afterwards the guy said, you know, it doesn't sound crazy. I mean, he says, it sounds kind of amazing. And he says, look at your dad, what do you got to lose? And so I put him on a plane and got him down here. And, you know, we shot him in the hip. And they thought they had to do 2 hips. So they had enough for 2 hips. But it was so much, but they put double the amount in 1 hip. And then, of course, they just dropped some into his bloodstream, like 100 million cells or something like that. So, but every ailment that this man had kind of righted itself, and pretty quickly, too. And he started walking without pain, and he became back to his lucidity, and his kidneys were okay, and his heart and his lungs, and his eyesight got better, and he even started getting little pigments in his hair and stuff. It was like, it was insane.
He's spicy. Right? Yeah, he's spicy. Okay, so what are stem cells? So stem cell therapy, they've been doing research on stem cells since the 40s. So as of 2015, the blood and cord banks magically had their quota of whatever number of stem cells that they've been housing over the past couple decades. And since 15, physicians have been able to purchase them for treatment on patients. So you're going to start to see stem cell talks and stem cell therapy pop up now. And because stem cell therapy is regenerative medicine. A stem cell is a blank cell. That's not the picture. But stem cells are a blank cell. There's no DNA. There's no red blood cells. So there's no blood typing or blood matching. So if you remember back in healthcare class, there's a little petri dish, a small movie of a petri dish with a blank cell, and then it splits. And then those two split. That is a stem cell. Stem cells double. Over 28 hours, they will double in what they grow. And simply stated, stem cells go where your body needs them to go and become what your body needs them to become. So when Jenny or Casey, RPA, when they inject stem cells into, let's call it a knee, into the knee, so they will inject 10 million stem cells into that knee. And a stem cell is an anti-inflammatory and a healer within itself. It attracts to inflammation. It attracts to, it's heat-seeking. So it'll attach on to any cell that's inflamed. A bone cell, a tendon cell, a ligament cell, a cartilage cell, and it'll make a new one within 28 hours. And that is how we grow new tissue. And it does that, and it repeats every 28 hours for 3 to 4 months. So they seek out degeneration. So their job is to rebuild and repair and help heal the tissue that you already have. They're anti-inflammatory in nature, and they're immunomodulatory. And what that means is they call to action the troops of your body to help with inflammation. They boost your immune system. They boost your immune system. So I really like this chart. So the type of stem cells that we use are umbilical stem cells from healthy moms, healthy babies. And we're going to go through that here in a minute. The type of stem cell is called mesenchymal, very fancy word, meaning that this type of stem cell is perfect to help make anything, but very specifically liver cells, bone, tendon, ligament, muscle. So because we are born with 37 trillion cells in our body, we have plenty of cells to help make. However, when we are born, for every 10,000 stem cells that we have, or cells in our body that we have, one is a stem cell. Plenty, so it's 3.7 billion stem cells that we start out with. As we age, we look like we're aging because our stem cells die. So think about our face. You know, as a newborn, we have these nice puffy cheeks, nice rosy color, lots of fat right here. But as we age and our skin starts to sag just a little bit, it's because we don't have as many stem cells doubling every 28 hours, repairing and healing the fat tissue, the skin tissue. That's how we get a few wrinkles as we age, because those stem cells are not constantly renewing themselves. And so as we age, we move up, and by the time we're age 30, for every 250,000 stem cells, or cells in our body, we have one stem cell. By the time we're age 80, every 2 million cells in our body, only one of those is a stem cell. And so what it boils down to, from 3.7 billion stem cells when we're born, we go down to, I believe that's 18 million. So as we age, the number of stem cells in our body decrease, which is why we use mesenchymal umbilical stem cells. They have the longest lifespan. They help to regenerate and repair the most tissue. So when we talk about our own stem cells, this is why. I don't want my own 40-year-old stem cells. I don't. I want the umbilical ones, because when I needed to make new knees, I wanted the longest lifespan of those so I could make the most. So the 5 types of stem cells are fetal and embryonic. This is the illegal style in the US, unethical in my opinion. We do not use this. That is not what we're doing around here. Amniotic and placenta, great stem cells within those organs. So the amniotic fluid and the placenta, that is what the baby is grown in. The reason why we do not use these stem cells is because they have a lot of debris in there, and that's typically what people are allergic to. Autologous is your own. You can get your own stem cells. You can get them out of your own fat or out of your bone marrow. This requires surgery, and also remember the lifespan of those stem cells and the quantity is going to be much more limited. And then HUCT, human umbilical cord therapy, and that's what we use. So our own is still expensive, and it is dependent upon age and our own health, and it's not potent enough for substantial difference. So one of the things you're going to hear me say in my clinic is that we do our business, we do our healthcare system based off of reputation, and I care about that. Now, I'm not moving anywhere. My family is here, and this is what we do. So if you come to me and you say, listen, I need to make new knees, I'm going to say, great, let's take a look. Let's do an exam. Let's see what you have, see what we're working with. And if you come to me and you say, well, listen, I can only get this many stem cells, and I'm telling you it's going to take this many stem cells, I am not going to do your therapy. I'm not going to do something that we are not going to get great results, because I have a great reputation, and I'm not going to chance that. So if you come to me and say, well, I only want my own stem cells, I'm going to say, great, not in my house. They're not potent enough. Umbilical cord stem cells are great because, and one of the reasons, they are undifferentiated, meaning they don't know what they're going to become yet until they attach to something inflamed, and there's no HLA matching. So you don't have to worry about any allergies or allergic reactions to them. The only thing that we will tell you is if you know that you are already allergic to sulfa-based drugs, take one Benadryl before you come in because they are cleaned in the hospital and in the blood cord bank with a sulfa rinse, a sulfa solution. And that's it. Okay, so umbilical cords, anybody can have them because there's no blood matching, there's no allergy reaction. They are the best anti-inflammatory activity modulators, and they can be administered multiple times, unlike cortisone. However, in our office, we are a one and done office. We have not injected stem cells into the same joint on any of our patients since we have started this 3 years ago. So I've had many patients come back for a different body part. They wanted to try it. Let's try a shoulder, see how it goes, and 6 months later they come back and we do their feet. So, but never the same body part. Stem cell therapy you can do directly into the joint or IV infusion. In my office, we do not do IV infusion. We only do muscle, tendon, ligament, joint. And that's what we stick with because I know that's what we're treating. Once we go into the IV, into the venous system, I can't tell you where it's going to go because it's going to go to the first place that is inflamed. Eyes, lungs, heart, couldn't tell you. Did you have a question?
You said on the mode there were intra-articular injection directly. Now, I'm here because of Carlin.
Okay.
So it's my neck and my skull. That's where I hit the car, my shoulder.
Sure.
Because I went right, and my right leg and foot. Do I even fool with you?
Yeah. Well, okay, so let's talk about it.
I mean, because this is different.
So in a few slides from now, you're going to see all the fun body parts that we like to do. But interarticular meaning any joint, neck joint, elbow joint, wrist, fingers, arthritis for fingers, knees, ankles, feet, any joint, muscle, tendon, ligament, or cartilage is what we specialize in. So a lot of patients, whenever they come and talk and they do their consultation with us, they'll ask about, what will their MD think and where's the research? Of course. So first of all, regenerative medicine is one of the fastest growing fields of medicine today. So as you have oncology, neurology, orthopedics, you now have regenerative medicine. And amongst each of the other disciplines, doctors from those disciplines are now learning and going over to the regenerative medicine side. So in a slide or two, you're going to see an orthopedic doc that is regenerative medicine specialized now talk about stem cell therapy. So when you talk to your primary care practitioner, they may or may not know anything about stem cell therapy because they don't work in that field of medicine. So there's one. And then two, as far as research, these are our favorite, I'm going to say government-based, national-based websites for regenerative medicine and research on stem cell therapy. We have a couple packets out front of the actual medical research articles that you can take home with you. But if you ever want these, we'll be very happy to give you these websites.
I'd like to ask a question.
Yeah.
A patient is in one of these clinical trials and it's deemed research. Does that patient's insurance cover that, or has it a grant from the government, or how does the patient get it for free if they're involved, or do they get it for free if they're involved in that?
I believe if you're part of a clinical trial, then you do get it for free. Insurance does not cover stem cell therapy at this point at all.
In the research hospital
They're beginning, yes. They're pulling the public in for different research. Yes, absolutely. And Sherry, she's our public relations staff member, so she can even tell you she has a direct correlation with that as well. So everybody knows. Oh.
Medicare and Medicaid? No.
Absolutely not. No. But we will go over that. Absolutely. You guys will know everything that you need to know about stem cell therapy, hopefully, by the end of this talk. So everybody knows Mayo Clinic, right? Yes. Yes. So this is, I'll let him explain.
I'm Shane Shapiro, an assistant professor of orthopedic surgery at Mayo Clinic in Florida, and I lead our orthopedic regenerative medicine efforts on the Florida campus. I'm pleased to report the results of a clinical trial that we've recently conducted to test the effect of stem cells to treat knee pain from osteoarthritis. We conducted this trial alongside FDA monitoring to determine if the procedure was safe and viable to perform for patients who have knee arthritis. We found that the procedure produces a viable product which has stem cells in it and can be used to inject back into the patient's knees on the same day that they're harvested. This is very important because it forms the basis for our future clinical trials as we try to regrow cartilage for knees that have osteoarthritis from stem cells.
So what he's talking about here are autologous stem cells from bone marrow. So they're surgically taking stem cells out of your own and then putting them in your knees. So if they're already finding the tissue and measurable growth for orthopedics from your own stem cells, you better believe that the amount of tissue that's getting grown from umbilical is much greater. So in our office, we treat many different conditions, whether it's with physical therapy, occupational therapy, chiropractic, I'm a chiropractor, medical massage, regenerative medicine, whatever it is, we treat many different things. Specifically with stem cells, we definitely think about using them for many of these. So chronic joint pain, back pain, herniated discs, those are some of my favorite to have help with. Spinal cord injuries, we don't inject for spinal cord injuries in my office. It works really well with them, but in my office, I would refer you out. Meniscus, so that would be your knees, your ACL and your MCL tears. Other knee injuries, arthritis. Anybody have arthritis? I do. Yes. So any arthritis, any joint, absolutely. Hip labral tears and tendinitis, absolutely. So the science and research, a lot of what they're doing in the clinical trials, it's not just arthritis that they're injecting for. They're doing clinical trials on psoriatic arthritis, lung disease, asthma, Parkinson's, ALS, heart disease. There's so many others that they're doing clinical trials on. And many of these type of syndromes will actually go through and put it in IV. Is it safe? Yes. So here are some of the fun facts that I want you guys to know about stem cell therapy. Is stem cell therapy FDA approved? No, it is not. It is not FDA approved. It is FDA cleared. It also is housed in an FDA approved blood bank and cord bank facility, and it is governed by, so stem cell therapy is governed by the U.S. Department of Health and Human Services, the FDA, the American Association of Tissue Banks, and the American Association of Blood Banks. All of it is governed and controlled by these federal facilities. However, it is not FDA approved, therefore insurance will not cover it. So it is an out-of-pocket expense, yes. According to the JMT, thousands of patients in the U.S. have been treated with umbilical stem cells, but there has never been a single instance of rejection or of an incident. In our office specifically, we've had no issues. Just period. No issues. Okay, so when I moved here 4 years ago, and realized, what I wanted and how I liked to practice and started building it, we started building our own program. And we like to call it the Heller Difference. So in our office, we really focus on corrective care. I like treating my patients. I don't like working on the same thing all day, every day. I really don't with that one patient. Patients get frustrated. They always have the same problems. They keep degenerating. I'm going to see them for their lifetime. Give me something new. So we work on correction, and then we maintain. And in order to do that, we start with repairing the joints. With that, we'll do chiropractic and or stem cell therapy, maybe one, maybe both. We'll work on muscle repair We may do physical or occupational therapy, or both, or medical massage, or all three. And then we also like to check your chemistry, because our blood chemistry matters. You know, inflammation markers, inflammatory arthritis comes from somewhere. If we can balance our hormones and we can balance the minerals in our body, we can help create a healing process for inflammation. And so when a patient comes in, they'll get a consultation and an exam. We'll check x-rays, we'll check MRIs, whatever is available, and then we create a program specific to each patient. It may include one of these, it may include all of these. It just depends. This is Dr. John Young. He is the MD that we originally studied under. He lives in Clearwater, Florida. He is a primary care doc that has changed his clinic into a stem cell only clinic. And he first got into this because he had 4 tears in his meniscus. He's an avid tennis player, as the pictures show. And with stem cell therapy for himself, on his updated MRIs, all 4 tears were healed. He was so impressed with his own results that he changed his practice based off of it. This is me. So who better to be their own patient in their own clinic? My program is different. So as a patient comes in, we assess and we create the program that you need. Jenny, our nurse practitioner, came to me one day and she said, "Dr. Jen, you're not being a very good doctor. You need taken care of." And I said, "No, I am fine." And she's a little spicy as well. So she created my program. I had a few concerns that I needed addressed. One, I had torn my rotator cuff, and I'm a little stubborn, so I thought I could duct tape it for, 3-6 weeks, but I adjust all day long. I jump on people for a living. I correct them for a living, and I'm bent over a table all day long. And amongst those weeks, I also injured my elbow trying to deal with it. So she injected stem cells into my rotator cuff, into my elbow, and it was great. I was grumpy for 3 weeks, I'm going to tell you right now. When you get stem cell therapy, you have growing pains. On and off, dull, achy, and I don't like to be achy. I get a little grumpy when I get achy. And so, I got achy for 3 weeks. And that 3rd week, magically, it was one of those miracles. I wish I could push a button and gold fairy dust came out of the walls.
Well, I'm 80 now, so what?
Well, so that's, I'm a baby. So part of my program was taking care of my shoulder and my elbow. 3 years ago, when we started stem cell therapy, I had my knees done. When I adjust knees and I get them in better alignment, I hold on to the patient's knees and their legs, and I have to bend mine to help get the motion. And when my knees are noisier than my patient's, it's really bad advertisement for chiropractic. So I got my knees done. Same results. They were achy, and then they were great, and they are still not noisy, and this was 3 years ago. As you can see, I've lost a little bit of weight. So when we did my blood analysis, part of my program was looking at my blood chemistry. My hormones were off, and my thyroid was off. And amongst getting those corrected and balanced, and on a much better diet change, and we have a weight loss program in our office. Within the course of 3 months, I went from 190 to 148. So my program looked different than maybe yours. And this would be my family. They're cute little boogers. Deanna. So I put this slide in here. Deanna had an accident, shattered her elbow. I had titanium plate put in and plenty of screws and bolts. I put this in here because she had stem cell therapy after her surgery. She still had pain, and she still had a lot of things that she couldn't do when working out. And stem cell therapy for her was not for the joints. It was really for the scar tissue after surgery. We have done many knees that have already been replaced. Total knee replacements, hip replacements, nuts, bolts, and screws within the spine is not a deterrent for stem cell therapy, because Remember, a lot of our pain and dysfunction that we have is from ligament, tendon tears, inflammation, and muscle issues. So when injecting and when looking at different joints and body parts, we assess soft tissue as well as the joints. Jenny. So our patients, as they go through stem cell therapy, some of our patients are just so happy and just so grateful for the benefits. They just cannot help but to talk about it. And actually, we have one of our newer patients here today, Nancy, who graciously said that she would give her story. But Janice is one of our favorite patients. She was just so thankful. She's a widow. She was very happy to go in the paper to tell her story, let alone for us to tell it for her. And her problem was her shoulder and her neck. And with after losing her husband and going through all of that, she just was not happy with her life. She couldn't go to the hairdresser. She couldn't lean her head back. She couldn't lift her arm up. There's just so much going on. And her orthopedist said that there's nothing they can do except for a total shoulder replacement. And she was not having that. She's more spicy than I am. So she comes in grumpy because she's in pain and decided she had nothing to lose and she wasn't having surgery. So she reluctantly said, okay, let's do it. You know, all right, so we got to work on the positivity, but no problem. And I remember the day, it was probably 6 weeks in. She came in and she's like, look what I can do. And I just got my hair done. My arm didn't go numb. And tears of joy came out, and that was the day that I realized, all right, you know, I can go out and do public speaking. I can go out and talk about what we do in our office because it's changing people's lives. This is Colonel Bob. Colonel Bob is one of our favorite patients. This nice gentleman actually grew 1.25 inches. And which, you know, when you think about it, okay, so I'm going to get you taller? Well, So Colonel Bob's issue, he had spinal stenosis. Spinal stenosis is bone growth within the spinal canal. So can I remove bone? No. I can't dissolve bone. That is not what we're doing around here. What we can do is we can change the angles, we can change the flexibility of your body. And with that, we changed his ligaments, his tendons, and his cartilage. And because of that, he was able to get more upright by 1.25 inches. So we like to say, yeah, he grew 1.25 inches, because he did. All right, so there are always very similar questions that pop up on these talks. So I'm going to go through those, and then Nancy, if you wouldn't mind sharing your first bit of your story, that would be lovely. All right, so everybody answer with me. Are stem cells FDA approved?
No.
No. No. Turns out you can't put a patent on something that's natural. So vitamins, herbs, supplements, stem cells, no patent, not FDA approved. How long does the treatment take? Well, an injection is an injection. There's a needle, you stick it in, and then you pull it out. So 30 seconds. However, you will be with us for 1 hour, 2 hours, 3 hours, depending on how many body parts we're doing. We give lots of breaks. We try to cater to the patient's needs, but the injection itself is just in and out. And it's a one and done. How many treatments do I need? Well, I'm going to say one and done. Are there any potential side effects? Yes. Awesomeness. Now, is there a chance that you might get an infection at the site? Yes, it's an injection. But they use betadine, they clean the site, we take all the precautions that we're supposed to with injections. Did you have a question?
Yes. Do you need to get all your injections at one time, or is it possible that you can get, like, if you have your knees, do your knees and then come back and do your feet, or do your feet or your knees? Or
You can. I will let you know that it's better to get it all done at one time because there is a synergistic effect. Okay. Absolutely. And I'll also tell you that you'll be able to use, if you have medical insurance and you need additional support, you'll be able to get that support using your medical insurance versus using it all up and then coming back 6 months later and then needing to do it all again, and now you have to pay out of pocket. Like, we'll help you guide through it.
But then you did say you do have one reaction, you have like a flu-like symptoms?
If you have a sulfa sensitivity, then you take a Benadryl before you come in, and that's it. You can have the achiness from the growing pains.
So then if you have it like in your knees and in your feet and in your shoulders and wherever, then you're gonna be achy all, really.
Maybe, maybe not. Maybe not. I was. Not all my patients are. And I will overwarn you. I would rather overwarn you and you come back and tell me that I'm a big baby. And most of my patients do say that. But you will have some achiness here and there. Maybe if you get the knees and the feet, so maybe the knees will be achy, but the feet won't. Or the feet will, definitely different body parts react differently, for sure.
Does it cause any fever?
No, no. Are there any potential downsides? Well, it's the same things as far as any kind of injection. But again, they use betadine. They clean the site. How fast will I see results? This is my favorite question because my answer is, I don't know. I'm supposed to tell you that you will notice a change and you will notice them working within the first 3 weeks. I've had patients on the same day say, I have no pain, or I can already tell they're working, or I can already do this. I've had patients the next day say, look at this. This is what I can do. I have, whatever it is. And then I have patients, Colonel Bob, for instance, was the longest. Colonel Bob didn't see any change until the 3rd month. But between month 3 and 4, that's when we got all of his changes. So understand that these little boogers are going to be growing for 3 to 4 months. And so as they're growing and we're helping to rehab them, you're going to see those changes go that entire time. So how fast will I see results? I don't know. But we'll be there when it happens, and it's going to happen. Will my insurance cover my treatment? No. I wish it would, but no. How much does it cost? This is also my favorite one. And I'm going to tell you, I don't know. It costs a lot. I'm going to tell you, and that I can tell you. So depending on how many stem cells we need to order for you is how much it will be. So the best thing to do is to do a consultation, start with x-rays, and then we talk. And maybe we can make it work, maybe we can't. We do have financing options. There's an option out there to be able to make monthly payments. You can pay it off as up to 7 years, I believe is the longest term. So there are options, but it is expensive, absolutely. And so just understand that going in. We're making new body parts. It's expensive. Where are we at? Okay, Nancy, would you mind coming and speaking?
Yes.
So Nancy and I are new best friends.
Yes.
So we met each other, 2 weeks ago?
Was it 2 weeks ago?
3 weeks ago at the most?
No, I was thinking less than 2 weeks ago. I was injected last week, 7 days ago.
Yes. So
I came to a meeting, got to you as fast as possible. I got to you the next day.
The next day, yeah. So I met Nancy here at one of these talks, and here, I'll let you talk. I've talked enough.
Okay, so my name is Nancy Singletary. I moved to this area, thank God. I moved to this area, thank God, in January of this year. And I still don't know how I got a phone call from her office. I've never met her, and I'm like, what? It wasn't a phone call, it was a text message. Come to this meeting at the Brunswick Country Club, and I'm like, you get a free lunch. I thought, what, can't lose. So I came to this meeting and was just, we've all heard of stem cells, don't know anything about it. So I came to this meeting and I was like, everything she said made sense, everything. And I had the moral issue, but healthy mama, healthy baby, umbilical cords, I don't have a problem with that. And, but I was in a wreck when I was 13, so I've been in chronic pain with my neck my whole life. And when you're in pain, you just live with it, right? What level am I on today? 7, you don't do anything. 8, you take a Motrin or whatever. 9, 10, you go to chiropractors, you do everything you can do. There's nothing you can name I haven't done over the years to try to be out of pain. And you just learn to live with, well, that was a waste of time, But anyway, as I aged, I'm like, oh my God, I'm not hurting just here, I'm hurting everywhere. And just severe arthritis runs in my family. And I'm like, I'm a naturalist. I don't believe in doctors, but if you have to do a doctor, go to a chiropractor, osteopath, Stay away from those typical MDs. And I don't mean that as ugly as it sounds, because I was a nurse for many years, and when I was a nurse, I stayed away from them. But anyway, I was in so much pain, and I'm like, I can do this. I'm going to go to the gym. I'm going to do hot yoga every day. I'm going to ride my bike. I'm going to swim. I'm going to walk on the beach, and I'm going to cure myself. I did all that for 2 years, and I'm like, I still hurt. And then I get this crazy text, and I show up, and I'm like, oh my God, everything she said made sense. I couldn't wait to get to her office. I wanted to go to her office that day. So I went the next day. And so anyway, I was injected. I have plantar fasciitis in my feet. I was injected in my feet. I was injected in my knee, both knees, both sides, tendons. What is the other thing?
The cartilage.
Thank you. Cartilage, meniscus, my knees, my fingers, all 3 joints. Thank you, God. My neck, my shoulders. We were like at 12 cc's when it was all over, and it was like an all day. I brought my banana sandwich to have some potassium to go along with the day. So anyway, what she didn't tell you about the shots is that she sprays this stuff on it for a long time, and it numbs it up. So it's not horrible like you'd think. So the shots are not even that bad, okay? And so before, 8 days ago, I couldn't do this. And now I can, I can just do it up and up and up and up and up. So I'm just saying, I'm about 90% out of pain. And I'm like, I just can't believe it. I just can't believe it. And when you talk about living in pain and the opportunity to not live in pain or to decrease that, and as I understand it, she said the older you get, but anyway, I'm not going to get into that. Money's not an option. You know what I mean? You just do what you got to do. And I am so grateful to God that I got that crazy text that said, come to the Brunswick Country Club, and I'll get a free lunch, and out of that free lunch, I get to live pain-free. And I'm just so grateful to God for you, Dr. Helen.
You get a hug now. So you get a hug.
Quit talking now.
No. I'm so proud of Nancy, and she has such a great attitude, and already does so many good things for herself. And it's it's the attitude, and it's the willingness, and I have to tell you, it's a lot of trust. It is, and it's a big responsibility on our office, because it's ours to make sure that you get as much as you can.
And it was. For me, just for me, I can't speak for anybody else, it was immediate. I mean, like that afternoon, I was like, I can do this, and it doesn't hurt, and I can do this, and it doesn't hurt. And so what she had with the whole 3 weeks being a baby, I didn't have that. It's just been, it's just been positive all the way, and I'm like, am I going to get better? Am I going to get better? Today is 1 week.
Yeah.
I can't imagine getting better. I mean, if I don't get any better than this, I'm good.
How many injections?
A lot. Well, so
From
we order by the CC, and then we have to split it up based off of where we're going. So we hide all of the needles so that you don't see them, but we have to divide them up and have them prepped and ready for you. So it depends on how many body parts, how many joints we're doing, as far as how many CCs we order, and then how we divide it up.
Yeah, we did 12 CCs, and honestly, the nurse practitioner did the injections, but she hurt me more than the nurse practitioner, because she comes in and marks where the nurse practitioner does, and I'm like, ow, that hurt.
I'm the tattoo artist,
yes.
So I mark the spots, but I have to make sure that I get where I want them.
Right, but
So
that was...
I mark it with a pen.
Yeah, the shots was easier than that.
Yeah, I'm the mean one. Yes, ma'am.
How long does this last?
As long as your tissue lasts. So here's what we do. Some clinics will do a stem cell injection and say, good job, high five, go grow, and then they won't see you again. We don't do that in my office. So we use some of the other modalities like physical therapy or chiropractic or massage or these other modalities to help ensure and restructure your new tissue. We have to love it and support it. So you're growing new tissue. It will wear down just as fast as the rest of your body does as we age. So the best thing to do is grow the new tissue, heal what you have, and then maintain it. And that's what the other modalities really are for, is to help maintain it. So it'll last as long as you do. Yeah. Yes, ma'am. Yes. So we see a lot of diabetic neuropathy within our office. So we'll do below the knees, we'll do the lower legs into the feet to help with that. Janice, the first lady that we talked about, she came in for her neck and her shoulder. She's one of them that came back for her feet for her neuropathy. So we did feet and the lower legs. And it probably would have been 3 days later I saw her for her adjustment, and the color change on her feet was already pinked up. They weren't plain white anymore. So yes, that's the answer. It's a short answer. Yeah. Are there any other questions? Yes, ma'am.
They diagnosed me with something called Raynaud's.
Yes. Yep. Red, white, and blue. Yes.
When my feet turn almost black.
Okay. Well, red, black, and
Right.
white.
That, I mean, they're
Yeah.
clean, but, you know,
Yes.
they will turn. They
Yeah.
just get real cold and numb, and
Yeah.
there's nothing, you know.
Yeah.
And sometimes people tell me, I'll touch them and say, your feet are freezing. I'm not cold. And I said, no, your feet are freezing.
So stem cell therapy will help with Raynaud's. It will not take it away, but it'll help with it. That's the other thing. So whenever we do Millie out front will be signing you guys up for free consultations and free x-rays if you sign up today. I'll be very happy to provide that. So one thing that we will talk about is really good expectations, because what I do not want is for your expectations to be here, and if I cannot meet them, well, you're not going to talk kindly about me, and I don't want that. So we make very realistic goals and have great expectations. And if I can exceed those, well, then I'm winning, and everybody has a great day. So one thing I will tell you about that is, can it help? Absolutely. Is it going to take it away? No. No, you'll still have it. But keep that tissue alive. Keep it as strong as possible, and your feet will last you longer.
Right, well, I exercise all the time, but I just got the diagnosis, Tuesday, that now I have the ligaments, the planters ligaments that run through my feet are starting to fray on both of my feet, but
Yeah.
my left one is worse than my right one.
Yeah. So plantar fasciitis, especially with Nancy, just works great. Stem cell
Yeah, because
therapy.
if you lose that, you have to have surgery, and then you may not even be able to walk after that.
Yeah.
I had surgery. I wish I had not had surgery. I had surgery on one foot, refused to have it on the other foot. And for 7 days, I'm like, what feet? I'm like, oh yeah, I have plantar fasciitis. My feet do not hurt.
Yeah.
That's good to know. Now, do you have to wear a certain type of shoe the
I've
rest
done
of your
all of
life?
that.
You just wear whatever you want?
Yeah, but this is new to me. This
Yeah.
has only been 7 days.
Yeah. Yeah. Are there any other questions? No? Yes.
I have a question. This is a little bit off topic, maybe irrelevant, but you are very knowledgeable, so I wanted to ask anyway.
Sure.
I understand that you deal in or not, it's the wrong word, but the umbilical, stem cells with the ones that are taken from one's own body.
Mhm.
Just, if someone, somewhere chose to have the stem cells taken from their own body
Mhm.
and put it somewhere else in their body, does that then leave them deficient in the area from which they were taken? You know what I'm
Well,
saying?
so they're either taking it from fat or from bone marrow. So either way, you'll still have the stem cells within your body, but yeah, you're replacing them into the knee, from the low back spine. So sure, yeah. That's not my specialty, but I can't imagine why it wouldn't. Yeah. Yes, sir.
Your stem cells are old. You don't want them back. You want new ones.
Yes.
You did.
Yes, I want the umbilical one.
I was curious.
I didn't want mine either. But yes, yeah. Yes.
She's not your age.
Nobody in there.
Oh. Okay, are there any other questions? Yes, ma'am.
Where do you get your, who harvests your stem cells?
They come from the blood bank, from the blood and cord bank is where they come from. We get ours from Texas, actually. So, Texas.
And what sort of test, I know you said it's not a blood product, but
Mm-mm.
what sort of test do they run on it as far as transmitting?
Well, the hospital that collects them cleans them, and they run all of their tests, same tests that they run on, a newborn. The same tests that they run on the mom as far as any kind of communicable diseases and pathologies. And then they sell them to the blood bank, the blood and cord bank, and then they do all the same genetic testing. And I believe they even screen for any kind of mental, physical, and chemical abnormalities as well. So it's the same process that they do for housing blood whenever blood is donated. It's all ran by the government, all FDA approved testing. So, yes, sir.
How would it affect your hearing?
Oh, well, we don't inject into ears. And we don't do IV, so I'm gonna say, I don't know. Couldn't tell you.
Without this, I can't hear anyway, but this helps.
Good. Well,
If I
keep
read
that with you.
But he's reading your lips mostly because he doesn't hardly hear even with that.
It's a good thing I have a big mouth.
Yeah, that's true.
Mine was, okay, when you inject the stem cells, do they stay right there, like in your knee, or will they move out of there if there's another area that's close by that needs attention?
That is a really good question. So let's take the knee, for instance. So whenever we do a knee injection, we'll look at your x-rays to see where the most degeneration is. We'll look to see where there's a little bit of cartilage left. And so typically we'll either inject only on the outside or only on the inside. If it's pretty significant, we'll go on both sides. But we don't just inject the knee joint, we'll inject the tissue around it because those tendons are already damaged. There's already scar tissue there. The ligaments are already sprained and strained and overstretched. So when you get your knee done, it's not just in the joint. It's in the joint, it's in the joint, and then all the tissue around, and any scarring that I can find going up into the leg. So it'll go right there.
It might take more than, like, say, you said 12 cc's for just one injection. Is that?
Well, typically it'll be like a knee might be between like a 2 and a 4 cc-ish, depending on how much degeneration. So that's why we look at the x-rays, and then, so on your day of consultation, you'll know how much it's gonna be. You'll know what the idea as far as how many cc's we wanna start with. You'll know what it is. We just need to look and do an exam. Yeah. I like it when people call the office and they say, I heard about that stem cell therapy, how much is it? It's really hard to diagnose over the phone. It just is. So I say, I don't know.
No, because, and then like, with your neck, like if you do one disc, but if there's other areas around.
We'll do those too. So, and Nancy, I think you probably heard me say it, but I will tell a patient, if we're gonna do a body part, we do the region. We don't just do one spot here and then one little spot on the toe. If we're gonna do the foot, we do the foot. If we're gonna do the neck, we do the neck. And if we have to split up body parts because of finances, typically that's what it is, then we'll do a region. We'll do upper half or we'll do lower half, or and then that way we can concentrate them and not just do one here. Because you're right, if there's inflammation in the joint below, it's gonna wanna try to steal it for the joint below. So that's why when we do it well.
Okay, and also, what about bone spurs? If you have bone spurs, do they still have to be removed, or do these kind of?
So now you're talking, as far as removal of bone spurs, I'm not gonna give you any advice on that. It would be orthopedics. However, what I would say is if I'm gonna work with a foot or a spine that has bone spurs, many types of arthritis, the majority of them will create bone spurs along the vertebra of the spine. So, I work with that all day long. And we get great results. And we get great results with plantar fasciitis. Many of those patients have a bone spur on their heel. And so if you can make that tissue more flexible, if you can heal the tendon, the ligament, and the muscles around it, and you can get that tissue more flexible, which is why PT will typically say stretch and exercise. Keep it mobile. Make sure whenever you're laying down, you have your foot, like this, and not shortened. they're missing that one component of regenerating that tissue. You got to get up and over that hump. But even with a bone spur, you'll be fine as long as we do the process in the right order. And that's where it comes from.
But they will remain.
Yeah, yeah, I can't dissolve bone.
No, I didn't.
That would
know
be
if
cool
it
though,
helped
but
dissolve or what,
no,
you know, I'm just.
no, they'll still be there.
Question, I'm curious.
You got to name it, give it a name, talk lovingly to it. Yeah.
Somewhere in the presentation, I think I saw the words mental health and addiction.
Yes. So think about that, the typical traditional medicine model. You know, when we're given pain pills, you know, there's strike one, and then we're given stronger, well, there's strike two, you know, and so it turns out pain relievers, the way that the brain feels pain goes along the same nerve that anxiety, depression, and panic go along. And so when you take a pain reliever, it calms you down mentally. It calms you down. And so when somebody is going through anxiety or panic, if they have a headache and they take ibuprofen or whatever they like to take, it will calm them down. It will. So if you give them a narcotic or even something like tramadol or meloxicam, it will help calm them down. So people get addicted very easily to pain pills. Or even think about over-the-counter medications. Do you know anybody that takes 4 pills a day, 4 pills at a time, 3 times a day, or 6 times a day? You know, it's not just pain. A pain syndrome comes with anxiety, panic, and depression. And so that addiction is not just pain, it's the emotional stability as well, for sure. So yes, yeah.
So it does help that.
Well, if we can get you out of pain and we can get you off your pain pills, yeah, you're going to have a much better outlook on life. Absolutely. Yeah, absolutely. But no, we are not injecting into your brain. No. Not in my office, no. Okay, so Millie will be out front, very happy to set up your free consultation, and she'll tell you, you know, if you make your consultation today, because frankly, I like to know my schedule. I do. I like to know my schedule. We'll take care of, at my cost, we'll take care of your x-rays, and so if you need x-rays. And so Millie will be very happy to get that all set up out front, but please enjoy your lunch, and I will be around if you have any questions you want to kind of talk to me privately. But I do hope I get to meet all of you. So, thank you.